Now you can work on this in one of our future tapes on joint articulation and mobility, but you'll remember this drill was partially introduced in the breathing tape that this is where you're coordinating your movement, your alignment, and your respiration. Now we're going to work this together when we come in with impellant force, force that is approaching. Now, we've just had this huge monster standing on us, all of this massive weight standing on our abdomen. His little tiny paw is nothing compared to all of this, okay? Now remember that. It's in proportion. I don't care how strong this is, it's not going to equal how big that is. Okay, now we're going to work on this same drill, and we're going to start with, first, a light amount of application, a little bit more, a little bit more. Remember, it's incremental. Now, notice, it's not, yeah, I can take it, come on, come on. If you tense up, what's going to happen is your muscular contraction is going to allow no room for your diaphragm to travel, no room for your organs to travel. We've seen much too many in sports. Ruptures of pancreas, ruptures of the liver, ruptures of the kidneys because of fear reactivity, the tension caused in the muscles. Think of this as most of you in law enforcement know this right away. Who gets injured in an automobile accident? The sober person or the drunk person? Of course, the sober person, because the drunk person bounces around the cabin. Now, I'm not encouraging you to drink through your training, but what I am saying is to stay relaxed and work on diminishing your fear reactivity. When this impellant force, so that when it comes, you can absorb this force easily because you're allowing your organs to travel. It's nothing compared to all of that weight standing on our stomach. Now, it also, not just this dropping, but straight in. Dropping, it looks like the body can move at an angle away. The same hollowing out comes backwards. This is our instinctual response, and upon which you can sew in your individual skills. When we talk of shock absorption, we're not saying that if you're attacked, you can do nothing to me. I'm impervious. That's not that drill. You're not impervious, you're not invulnerable. That's not what this is for. This is not a skill like we were saying at the beginning. This is an attribute. If you diminish your fear, you're going to have the presence of mind to apply your individual skills from whatever style that you happen to be studying. If you're fear reactive and he motions towards your stomach, you may not, and you probably won't, have access to your fighting skill. And that's what happens to us when we just train in the particular techniques of our style and not in actual force play, where we're actually absorbing force. This shock absorption is our means to have access to our individual fighting skills. So dropping, inserting linear, in rounds, the force is still going to be absorbed and you're going to collapse and move underneath its application. The same thing is going to be true when a foot is impelling. Back up a little so you can give me some juice. That's a lot of kick. But remember, this is incremental development. He can apply all the force he wants. Our job is to diminish our fear to its approach. Remember, false evidence that appears to be real. Fear. False evidence that appears to be real. Is this a true threat? If it is a true threat, how much of a threat is it? We can respond with our individual techniques once we have the wherewithal to know exactly how much force he's going to be applying so that we can respond just as much as necessary. Efficiency over effort. A few more examples of taking your individual skills and working them towards force or shock absorption would be the impellant force from a kick from the side to absorb that so that you become less reactive to that chamber. When you know that chamber is beginning, you're more able to respond to it rather than it's coming. So you get tense up. And if you're tense here and you do receive, slowly, you do receive a blast, that's when you're going to have the wind knocked out of you. The same thing from a kick coming around to the side. If you stand here and try and take it or fearfully avoid it, that's when you're really going to get hurt. You'll break an arm. Relax into it so that you're not taking any injurious impact from it. Okay? And the last, some of you wrestlers know this. A gut wrench, you can make someone pass out if they... Some of you have read one of the articles I wrote on the myth of strangulation. That strangulation is from the Valsalva maneuver. And that is when someone gets fearful, they cause an overmobilization of their chemical cocktail inside of them. That causes them to pass out. If they get fearful and you grab them, you ever do this as kids? Make somebody breathe out and then you squeeze as hard as you can and they pass out? Well, that's what a gut wrench can do to you. If you breathe out, and you can really clench here. Now, Doug is holding in his breath and he's not breathing. That can make him red and a little dizzy from this gut wrench, and this is a way to relax when if you're in a grappling game. Go ahead. There's not much he can do. He can't lift you because you're dead weight. Dead weight. If you're tense, what happens? Go ahead. He lifts you right off the ground because you're one solid object. But relaxed, go ahead. You're super heavy. Okay? That leads into your technical skills, especially for grappling. Because of your ability to relax, you're more able to move. We'll go on to more of that on a future tape. Those of you that are involved in any type of firearms training know that the most difficult place to move is center mass. So, if you can move around impellant force from center mass, this is one of the most functional ways to teach yourself this attribute and to lessen your fear reactivity. So, taking this strike away from the abdominal wall and up into this armor casing, if you can move this bodily armor through your joint articulation, you'll be able to move any spot on your body. We'll start with the straight impellant. Remember, incremental force, thank you. And then slowly increase the force. So that you're collapsing underneath the force, and notice that it's hollowing out and you're not getting tightened from it. If you easy, if you get tight here and you fixate, when you take a shot, it's really going to embed the shock. Now, some of you know that you can snap back and deposit a great deal of force, or you can follow through and deposit equally an amount of force. If there's not a resistant object, you cannot put the force in it. If you hit a wall, now the wall's stronger than your hand's going to explode. But if you hit something softer, you can deposit the force. But if it's not there, there's nothing that he can do to deposit it. Now, overhand. Same thing. Remember, we're not doing this for tricks at parties. Look, Mom, I can get the hit as hard as I can. It's impressive, but remember that this isn't a self-defense skill. This is an attribute that we're developing to apply to any particular style or combat sport that we're working on. So even if it were boxing, it's not so that we can take shots, but so that we diminish the fear and then have the wherewithal to respond. If we know that impellant force is coming because we're not having a fearful reaction to it, go ahead. We know where its root is coming from. We have the wherewithal, the presence of mind to extrapolate where it's coming from. In future, in the other sections of this series, we're going to be talking about how to preempt that approaching impellant force, because we're not fearful to it. We don't have a reaction to it. If he draws back, we don't have this reflex action anymore. We know exactly what his body's going to do. When we get too caught up in our technical game, we forget that what we're dealing with is force. What happens in our body when we receive an impact is there's a neuromuscular excitation. You've excited the muscle, and there's a nervous communication throughout the body. If you pinch someone, they have a reaction throughout their whole body, and Doug doesn't like that very much. I don't like it either. That neuromuscular excitation is what we're dealing with and what we're addressing. Pain and the fear reactivity from the pain. Pain does hurt, but we don't need the extreme fear reactivity that causes injury. Okay? There's a difference between pain and injury, and that's what we're dealing with. We're going to start with this drill. I can't stress this enough. When you're working on this drill, do not aim your fingers at your partner's eyes, because you'll miss. You'll fatigue, and you'll accidentally jam your fingers through their skull. Aim your fingers towards their forehead, and your finger pads, not the tips of your fingers, especially those with fingernails. Aim them towards the forehead. When you do this, what you want to do is relax the blink reflex. How many times have you gotten hit when your eyes were closed? How many times? Most of us. How many times have you gotten thrown when you're in mid-blink? That's when it happens, when we're not paying attention. So you relax as those fingers are coming in. Relax the face, like we talked about at the beginning, so your blink reflex doesn't engage. Have you ever been to the eye doctor and they shoot that parcel of air right into your eye? It's almost impossible to stop from blinking. When you can stop from blinking, then you call me and we're going to put that on a future tape. But for now, what I want you to do is I want you to work on this exercise of relaxing the entire face. Remember, the facial calibration determines our state. So relax the face, and let that impellant force slowly increase until you see that Doug is now touching my face. That touching causes excitation in the facial muscles. When we get hit, I've seen, it's very unfortunate, but I've seen so many people that have been in martial art for many, many years who have never been hit. The first time they're hit, it's usually from something stupid like, and then they have no access to their fighting skills. None. Because of that emotional freezing that happens from impact. That's why shock absorption is so critical. And we get into, now from touching to slowly slapping. Once again, stay away from the eyes. Stay away from the eyes. Cut your fingernails. When that's slapping, work once again so that the blink reflex isn't kicking in, and so that you're not wincing or grimacing. If you start to... you're reinforcing the fear reactivity. You have to stay loose. How many times have you seen these elite and adroit athletes step onto the mat? They start slapping their muscles. Why is this? Neuromuscular excitation. They're acclimatizing themselves to force impact. If you walk into a fight cold, for instance, and you've had no shock absorption training, what happens is the first time you receive impact, you're frozen stiff. And it is a great tactic that criminals use on us. Any belligerent knows that he has to engage your mind and body. You know, hey, buddy, got a match? Your mind's engaged. Slap. Now it comes. Goof, goof, goof. The same thing in sport. If he can engage our bodies and trick us into a movement, he moves one direction, then he goes the other direction. That neuromuscular excitation that tricks us, that feints us, is what we're dealing with. When we remove that fear through one particular drill. Now, Doug's being nice. You can really start to increase this impact, okay? But remember, stay away from the eyes, and incremental development. If you walk up to someone cold and this is their first exposure to attribute development and slap them silly, you're going to reinforce their fear reactivity.